We have the privilege of being with Dr. Mark King, who is the current president of Motion Palpation Institute. Dr. King, thanks for your time today.
Glad to be here.
We are excited to learn from you. We're going to talk a little bit about some of the practicality of being a chiropractor. And one of the unique things about you is that you practice with your wife, your brother, and multiple other doctors. And I come from a chiropractic family as well. Practiced with my dad for a while, and I currently practice with my brother. And the family dynamics of having multiple siblings or father, son, or spouses in practice is actually a pretty common thing in the chiropractic profession. What can you say, maybe just from an advice standpoint, of how you've made that successful venture?
Well, I think a lot of it is, obviously it always boils down to communication, but a lot of it comes to, I always joke that you have to have separation of church and state. So
Exactly.
When you're at work, you can be at work, but you can't be on top of each other all the time. You have to have your patients, they can have theirs. And when you're at work, you have certain jobs where you work on it, and maybe your spouse works on these other jobs, and there's a clear delineation on who does what. You're in charge of this, you're in charge of that. And so there's not this overlap. There can't be bickering.
Yeah.
If someone's in charge of this area, they get the final say. Yeah. If you're in charge of that other area, you get the final say. And you want the other person's input, but you have to have somebody who has to be in charge of that particular area. So for example, if you're really good at IT, you're in charge of IT. If your spouse is really good at marketing the practice or handling the staff, that person's in charge of that area. So if you do that, it helps keep things more even keel. And another thing for your home life, if you're married to a chiropractor, for example, is we have a 9 o'clock rule in our house. After 9 o'clock at night, we're not allowed to talk about the practice or the business in any way. Once it hits 9 o'clock, you can't talk about it. So that keeps you from staying awake at night thinking about the practice, and that helps you be husband and wife and not just business partners. Now, I also practice with my brother, like you practice with your brother, but the same rules apply. My brother and I have always been very close, even when we were little kids, and we still are. But we definitely have, he does his thing, he has his practice within the walls, I have my practice within the walls, and there's certain areas that he's in charge of in the practice and certain areas that I'm in charge of. Yeah. And we're clear about that, and it makes it run pretty smoothly.
Yeah, it definitely comes down to communication.
That's the key.
Yeah, and the separation. Those are very good points. One of the other things about your practice is you have multiple practitioners. You have a physical therapist who works at your office. You have massage therapists and acupuncturists. How have you integrated your clinic and been able to do that successfully?
When we now have 2 physical therapists. Okay. And again, it's always about communications. Yep. We have weekly staff meetings. Yep. We have regular meetings with the massage therapists. The massage therapists in our practice are all part-time because they have their private practice, and then they come to work for us a half day each week or 2 half days each week, and they see patients. We call it regional muscle work. So they'll work on someone's cervical spine or their hamstring or whatever the problem may be, and we don't do full body like normal massage therapy. They go outside to do that. But there's really great evidence growing every day that what we do as chiropractors, if we talk only in terms of chiropractic adjustments, couples extremely well with rehab. Now, obviously chiropractors do rehab, obviously physical therapists do manipulation, but in our office it's fairly separate. We do obviously do a lot of adjusting, and we do some rehab, but then we also have physical therapists who do more time. They can do sessions for a full hour of rehab, and it works out very well. The evidence is overwhelming, like I said, that is the path of a lot of these spine and extremity related problems, that our combination really works extremely well. Yeah. So we know clinically that's the best thing, and we're always trying to be the best clinic. So we pride ourselves on that. Yeah. And if the evidence is pointing to, hey, this is the best way to go, we want to try and go down that road.
Exactly. That's great. One of the other things that I think is a great model for many of us is that you've had successful long-term relationships with associates. And a lot of associates or doctors who hire associates, it's just like one comes in, one goes out, and it's just this revolving door. But you've successfully had many of your associates for quite a few years, up to 18 years for a couple of them. How have you been able to create a situation where it really empowers them to want to stay in your office and to be a long-term contributor to your overall clinic?
Well, I've mentioned before about the communication thing, so that's big.
Yeah.
But a lot of it now is especially after they first get started, is you leave them alone.
Sure.
I mean, they know what to do. They don't want me looking over their shoulder. They want to be able to come in and discuss a case with me, just like I want to be able to go discuss a case with them.
Sure.
And so there's a give and take that way. The guys that I have in my office, they don't need me.
Yeah.
They can go anywhere and they'll be successful. They don't need me. So, and I don't specifically need them because we can make it work with them and or without them. But with that makes a very good situation. They know that they don't have to stay there. They want to stay there because they like it there.
Sure.
So I really tease and say a lot of it is I leave them alone.
Yep.
And I let them do their thing.
Yep.
So they are incredibly good clinicians.
Yep.
And they've built very, very good practices, very big practices.
Yep.
And we have a great support staff for them. We have a great facility for them. And they know that's a great opportunity for them to focus on that clinical side and build a great practice. If and like I said, if they wanted to do the entire thing and start a new practice, they know they could, and I think that really helps them to be settled where they are.
Sure. Yeah, and I think we're going to see more and more of that. The multi-doctor clinics. It's kind of the way healthcare is going, and so it's good to get that feedback in terms of someone who's done that successfully.
Well, along those lines, just briefly, just like we have an X-ray unit in our office. Well, we have 5 doctors, 5 chiropractors who feed into that. Unit. If I was a solo practitioner, I wouldn't have an X-ray unit at all. I would find a local facility to do that, so we can share the costs.
Exactly.
Our treatment rooms are being used all day.
Yeah.
Whether I'm there or not, they're being there. And if a patient needs to be seen when I'm out of town or one of them is out of town, we can cover each other.
Yep.
So there's multiple reasons why it works well. One of the things I always say is, do you play well with others?
Yeah.
Meaning, if you don't really get along well in a group and you want to be solo, then don't get into a group practice. But the wave absolutely is to be group practice. And you can see it in the medical groups. You can see it in law groups. They all do a group practice, and there's reasons. Yep. They can all bring their own individual strengths. There's economies of scale. There's a lot of pluses to it. But that key one is, can you play well with others?
Yep. And so for students out there who may be trying to decide on an independent contractor, an associate position, or opening their own practice, what advice would you give to the students who are watching this in terms of how they should go through that process of making that decision?
Well, I always say, in an ideal world, the best situation for a new grad is a good associate position. And the key word is a good associate position. It has to be a situation where they want to be there and then the owner doctor wants them there. That's ideal because they can learn and grow. And if it's a good situation, they can stay there. Yeah. They could buy into the clinic, or they can move and go somewhere else. Second would be an independent contractor where the office is in place. They don't have to put out a lot of money to get equipment. The staff is there, the equipment's there, the building's there. They can walk right in and they can start seeing patients. So there's a big cost savings there. So that's a good situation for them. I would say second to the associate position, because the downside is there's not a guaranteed income, whereas an associate normally gets a salary to start. But the independent contractor has to put out a lot less money initially. What I would warn them is make sure that it's truly an independent contractor situation. Yeah. And that's a legal question, but make sure they're not just calling it that for some odd reason. Sure. Next, I would say if you can find a practice to buy, that you can walk in with an established practice. That's a little bit tricky for a couple reasons. One is, are the patients going to stay with you as you transition the other doctor out, as he retires, for example, or moves away? That's a big one. Financing obviously is a big one. And will the young doctor be able to get financing from a bank, or will the owner doctor finance them? Those are big things. But one of the real sticking points is many doctors overvalue their practice. So my practice is worth $10 million when it's really not. But in their mind, they think it's often worth much more than it is. And it's really worth what someone will pay. So what I'm saying is to the young docs is really pay attention to the details of what is that practice really worth. Sure. And there are measures out there to figure that out. And to the selling doctor, be realistic. I know you want to try and get the most you can for your life's work, but don't overprice it, because otherwise it'll be sitting there for a long, long time. Sure. And once you lose interest as an owner doctor in your practice, it tends to go down. 99 times out of 100, it starts to go down in value, because your heart's not into it the same way, and it will tend to go slowly downhill.
Thank you. Dr. King, one of the things about chiropractic is that it's very effective, especially when it's done appropriately and combined, as you mentioned, with different modalities such as rehabilitation, soft tissue work. And oftentimes I find practitioners, and this is something that I talk to a lot of my colleagues with, is that I think we have way higher expectations sometimes about the level of success we should see in a certain amount of time. We kind of get impatient when after 4 or 5 visits somebody maybe hasn't got to where we want them to go, when the reality is this person has had this condition for a really long time, and they may have multiple factors that are delaying recovery. What are some things that you can say to those doctors who do feel a little bit impatient, and just having that realistic view of how quickly things should resolve with treatment?
Well, with the way healthcare is now, people are paying more and more money out of their own pocket. And a simple analogy is if you go to a restaurant and the food's not very good and you pay your money and leave, if it's not very good and the service is not very good, you're not coming back because you pulled your cash out and paid. Mm-hmm. Well, patients are paying more and more cash for their healthcare, whether it's chiropractic or whatever it might be. That means they expect a certain level of service. And what it also means is the people that are going to go to the chiropractor are going to tend to be more sick, more injured. Yeah. They're going to wait a little longer than they should to get there because they're hoping it'll go away because they don't want to spend the money on that. So what I'm saying is you're in practice now, you're going to tend to see a little bit more sickly, more injured kind of patient than you might have seen 30 years ago, 20 years ago, let's say. Well, having said that, a lot of your patients are going to come to you with, pick whatever you want, low back pain, which is the #1 thing chiropractors treat. They come to you with low back pain they've been fighting with for years, with medications, and they've done this and that and the other thing. You have to give that some time to change. There's a principle that Len Fay talked about years ago called the SAID principle, specific adaptation to an imposed demand. You have to retrain that patient's body to what normal is. And I always use the analogy, if you're going to run a marathon, you don't just stand up now and go out and run a marathon. Yeah. You start running a small amount and build your way up, build your way up, build your way up. And it's the same way with your treatment. You have to give the body time to heal. And so when we get impatient, a lot of times we're just giving the patient a disservice. And I think some of that stems from our reputation as a profession of over-treating. Mm-hmm. So especially some of our younger docs overreact to that, and essentially they undertreat. So which is worse, over-treating or under-treating? Well, I don't really know, but the point is that what you want to do is perfect treatment. So what would really be your ideal treatment regimen for whatever the patient comes into? And I think sometimes doctors that don't get this idea feel as though they're being salesmen. Well, I never feel like a salesman because I'm only telling them what I think is the right thing. Sure. So I'm sincere in what I'm telling them. Yep. So I've never felt that way about what I was recommending, because if it was my mother or my brother, I would be telling them the same thing. Sure. Because I want to have a good result. This is what we need to do. Yep. But you do have to be realistic. And there's another part of that is if you give yourself a little time, maybe you even say you need to treat them more than you really think you might need to initially. Yeah. And let's say you treat them 5 or 6 times or whatever, and they're not getting better, and you reevaluate them and say, wow, I missed that the first time. I didn't really have the exact right treatment plan for this patient with this diagnosis. Yeah. That gives you some time maybe to change your treatment and get a good result. Yeah. And if you get them better than you thought you were going to get them, you've exceeded their expectations. Sure. You haven't just simply met their expectations. You've exceeded it. Yep. So give yourself a little time and take some of the pressure off of knowing that you had to get the diagnosis right the first time, and that this 50 or 60-year-old man who's had 5 years of low back pain, he might not get better in just a couple of visits. He may need to retrain and teach his body how to work differently. And so there is a combination of things that needs to go into that. Yeah,
that's very helpful information. Dr. King, one of the things that you've done really well in your practice is incorporate clinical nutrition, and it's not just take these supplements and just kind of a random crapshoot in terms of giving every patient that walks in the exact same thing. How have you integrated nutrition in a very successful manner, in a very patient-centric manner, so that you're really trying to address underlying causes with that?
Well, we know that often the inflammation is a component of the patient's condition. We have a simple question we ask, because a lot of our patients take an over-the-counter NSAID or a prescription anti-inflammatory. And the question is, Mr. Jones, does your anti-inflammatory help your pain? And if they say yes, it helps some or it helps a lot, whatever, we know that at least a component of their problem is inflammatory. So we know we need to address that. and I'll say to them, Mr. Jones, you realize you can't take that over-the-counter anti-inflammatory for the rest of your life. It will kill you, right? And they know that they can't take it forever, but they're in pain. They want to do something. So that kind of leads me into that idea of an anti-inflammatory diet, which is very simple. That we say over and over and over again. You eat fruits, vegetables, nuts, lean meats, and fish, and you can talk about organic, you can talk about wild fish, and you can talk about wild game and grass-fed meats and so on, if you want to get into more details. But it's very quick to say those 5 things: fruits, vegetables, nuts, lean meats, and fish. And I say that over and over and over again. And then a few key supplements that are basically anti-inflammatory in nature. And I learned a lot of this from David Seaman, who's a chiropractor and has always done a lot with nutrition, teaching nutrition and chiropractic neurology. So we keep it our nutrition is relatively simple. We're fairly focused on anti-inflammatory nutrition. So we can take care of a lot of things that come into our office. Now, we would like every chiropractor to have that superstar nutritionist that really just can take any condition and really take care of it. We can't take everything with what we do right now. But we do what we want to do. We want to do extremely well. We want to do it very targeted. And patients are receptive to that. And that little part about, you realize, Mr. Jones, you can't take that medication forever. It's going to kill you. They do understand that. And even other medications that they take, if they're taking statins, for example, we know that they need to be taking CoQ10 because that's going to be depleted in magnesium. So they're typically very receptive to getting that. And so our sale, so to speak, on nutrition is very, very soft. But it's very specific.
And there's such a need. I mean, you look at the rates of how many people are taking anti-inflammatories on a regular basis and the effects that it has. So it is a very clear cut for them to have that.
Amazing numbers of people are taking those. Amazing numbers of people are taking statins. It really is mind blowing, truly, because people just take them like it's just no problem, and you try and softly educate them that there are side effects to those things.
Well, thank you. That's very helpful.